We've got some big news this morning. Dr. Anthony Fauci has declared the U.S. to be heading out of the full-blown pandemic phase. The president's chief medical advisor noted in an interview with the Financial Times that he does not believe the SARS-CoV-2 virus will ever be eradicated, adding, quote, "I hope we are looking at a time when we have enough people vaccinated and enough people with protection from previous infection that the COVID restrictions will soon be a thing of the past." Meanwhile, New York Governor Kathy Hochul is expected to announce today that she will let the state's mask or vaccine mandate for businesses to expire this week as the state's positivity rate dips back below 5%. And obviously, we've been reporting all week on various restrictions coming undone. California, New Jersey, Connecticut. D.C. still has the mask mandate in place where we're reporting with Ryan and I.
And
so LA too. Yes, all of the hosts right now still have to deal with mask mandates, and we're just
vaccine
thrilled
passports.
About it. Yes, vaccine mandates as well.
Card to get into any restaurants around here.
But it is interesting, and so there was a New York Times story today about, or maybe this was yesterday, about the mask mandates being dropped indoors, and Phil Murphy dropping them. And I'm reading the details of this, and so I'm reading from this story. It was Governor Philip D. Murphy of New Jersey who began the effort last fall to remove restrictions, weeks after he was stunned by the energy of right-wing voters in his blue state who nearly ousted him from office in what was widely expected to be an easy re-election campaign, arranging a series of focus groups across the state to see what they had missed, and so on and so forth.
Democracy.
This is, so when we say the science has changed, what we mean is we read the room. What we mean is we've heard from voters and from focus groups. Apparently, I didn't know a lot of these were being done. We reported on the one done about the Youngkin victory or some of that stuff, more about schools narrowly. But
anytime you're shocked, you've convened a bunch of focus groups.
This is news to me that a lot of internal what went wrong kind of analysis was going on, but apparently it had been going on, and the conclusion was, yeah, we need to end the restrictions.
And so, Robby, you were saying that today the White House has a press briefing where they're going to announce some news about. And I was at the White House press briefing on Monday, and one of the questions that kept getting lobbed at Jen Psaki was New Jersey is rolling back its mask mandate. The CDC says you should still have a mask mandate in place. So, isn't New Jersey bad? Isn't New Jersey not following the science? And reporters love those when they can say, there's a gap between X thing and Y thing, and they can try to throw Jen Psaki through a hole in that gap. And so Psaki had to keep saying that states and localities are able to make their own decisions. That's always what we've said. And then they'd say, well, yeah, but the CDC disagrees with what they're doing. So it may be that coming out of the New Jersey pressure and that press briefing that today, the CDC might be moving, but clearly that's where the pressure is for the CDC to say, look, if follow whatever you want to do in your
and this is good pressure.
area.
This is Democratic pressure, and by I mean lowercase d Democratic pressure, democracy pressure. Biden should call up Walensky, be like, look, we've again read the room. Say it's over. Say it's over. Say we don't have to have our 2-year-olds masked in kindergartens anymore, preschools, whatever.
I don't know when they're going to get rid of that.
Yeah.
I'm just looking at the numbers here to try to see how they're going to spend it, because they are trying to say, well, it's because things are going down, things are better, or Omicron's less severe, or, so a lot of people are saying, well, but it is different. The science has changed, right? But in looking actually at the death numbers, which are more important, I think, than case numbers, I think when we look at case numbers, we know that they're skyrocketing. But the death numbers are actually not that different from January of 2021. I mean, we're looking at, at the peak of January 2021, the average number was about 4,000, a daily average, 7-day average. And now it is also roughly, 3,500. I mean, it is on the downward trend. I think it's hard to say, but because it's still way up there, but it's not a whole lot different.
Looking at the Times capsule here, they've got 2,573 for February 8th, which is up 9%. These are tough because they're going to have to be revised. Because you had this massive surge of Omicron, everybody, a huge portion of people who were dying every day, which is between 7,000 and 10,000 people, had Omicron. just because everybody had Omicron for like that 1 month stretch.
Right.
So there's going to have to be some revision of those
there were
numbers.
people dying who had Omicron, but it's not Omicron.
I actually don't even know if it was Omicron. I mean, honestly, like they say that, but they didn't sequence anybody. Everybody I know that had COVID around me in this last month, they never tested them to find out. But I will say that what I witnessed firsthand taking care of people with COVID was that it looked different than what South Africa was claiming. I mean, what South Africa was talking about was a headache and sniffles. I was watching people get sick. I mean, and they fully vaccinated, boosted people getting sick. I mean, they were in bed, like with the flu for days on end.
And you're right, they may have gotten Delta. Like Delta didn't just vanish overnight. But the key number here in the New York Times stats, hospitalizations, that's 111,000, down 28% over the last 14 days. So because hospitals are not overwhelmed, that has always been the thing that a lot of public health professionals and officials have pointed to. It's saying the time that you need to get serious about restrictions is when the hospitals can't take another body.
And that is what Walensky said in this most recent interview where she threw cold water on the idea of restrictions coming off. She said, well, it has to be the case that you can be in an accident and go to a hospital and get treated immediately. That's when the emergency will be over.
We're getting closer to that. We're getting closer.
Yeah, what's that, like? Is our healthcare system that great? Were we at that pre-pandemic that you were going to be able to get
if you're insured
A+ service?
Exactly.
Yeah, I don't know.
Pretty sure people complain about that.
And you're not in a rural area, the closest hospital.
Yeah.
I think also maybe what's helped, I guess, in lifting this is that I know that the hospitals have been overwhelmed this past, this winter, but a lot of it was because the staff, it wasn't that actually more people were showing up. It was that the staff was getting sick and then they had to leave. Yeah. Right. But then they had to modify. And I'm trying to remember where maybe one of you guys remember. Where was it where they said, just come in and work. We don't care. As long as you can work, just come in.
I feel like it was Boston or something. Yeah, I remember that. Yeah.
Yeah. They're like, come in with COVID. I mean, as long as you can, as long as you're asymptomatic. Well, and that's what they kind of say here in LA now and in California with Gavin Newsom lifting the mask mandate for people who are vaccinated. And again, you can only go into restaurants and bars if you're vaccinated. But we know vaccinated people are getting this virus. And so it's like, well, you can have an active COVID infection, I suppose, as long as you're vaccinated, then you could go ahead and spread it.
I know.
It just makes no sense.
I went to it feels so stupid. I went to a restaurant yesterday with my wife. Had to do break out the vaccine card, which, I mean, I have a picture of it on my phone. I have to get out the ID, have to show that they match. My wife had forgotten one or the other and had to like rustle through her phone for a photo of her ID or something while I had already gone to the bar. It just feels so stupid because it doesn't really connect to whether either of us are currently ill, or and we both had COVID too. It feels very dumb. So I agree with you on that. But anyway, we're hoping to see as many of these restrictions as possible. I am at least come down very soon. So that was interesting news from Dr. Fauci, and we'll be looking forward to what the White House is going to. You think? Yeah, I think end of the month will be the end for DC. Do you think yours is LA is gonna last beyond the month?
I don't know. I'm in the most liberal part of the country. Yeah. I don't think so. I think it's going to last and last and last.
You're in the most liberal part of the country. We're in the most rule-following part of the country. It's not quite a liberal thing. It's just like it's Karen land.
City of hallmongers.
And that's the other thing is I know that in D.C. they were shutting down places for not checking. But here in L.A. they're supposed to do it. But I'll tell you, most of the restaurants are not asking. They put a sign out and then they don't pay attention to it.
Well, there are some conscious resistors, but people who are not resisting they're doing it. All right, well, that's all for us. We'll have more Rising in just a minute.